If you live in the South or you suffer from severe stomach pain, it could be kidney stones. Today we look at why more people in the South suffer from kidney stones, the symptoms, and how to treat it. And we're joined by local neurologist and pain management expert, Dr. Chad Domain with the Avala Network. Dr. Domain, good day to you too, sir. What are the signs of this?
Yeah, John, kidney stones are a bad problem. They estimate about 1 out of 10 people have kidney stones in their lifetime. If you ever had one, it's one of those things like you almost feel like you're in a club because they're so debilitating. Severe pain on your flank, blood in your urine, difficulty urinating. You can get fever, you can get chills, you can actually get sick from this. Actually, one of my good friends is a urologist. He sent me some kidney stones so I can show everybody. And these are actual kidney stones that were removed from patients. But you can see the size of some of these things. But just to give an analogy, I stole the straw off of my kid's Capri Sun. This is about the size of your ureter. So imagine these stones coming down this narrow pipe as it's constricting. And these things are not perfectly round. They have edges, they have points. So it's literally tearing the ureter as it's coming down to get to the bladder. So it's very painful. They say it's worse than childbirth.
You make it sound painful, and I've heard that. So why more in the South? What's going on?
Yeah, so really weird. We're considered the kidney stone belt of the world. North Carolina has the highest incidence. I mean, long story short, they don't know why. The theories behind it, hotter climate, dehydration. We have poor diet. So if you eat high animal proteins, high salt, you're going to have higher kidney stone incidence. It could be genetic. So if your parents have it, you have a higher incidence. What was interesting is tea. We drink a lot of sweet tea. Calcium oxalate is very high in sweet tea. So they think there may be some correlation there. But I think it's a combination of our lifestyles, our diets, the heat, the dehydration. I think it's a little bit of everything.
Now, simple drinking water will help dissolve this, or is it more a preventive thing where you want to drink water?
So you want to drink water, but one thing you need to look at, especially in rural areas, if you're drinking well water, you could be causing your disease. So if the well water has a lot of calcium or impurities, that can cause the problem. Drinking good water is important because the hydration allows the kidney to filtrate properly and to keep those stones from forming inside the kidney itself. So you do want to hydrate, but again, make sure you're hydrating with the right stuff.
Well, finally, with at least modern medicine, is surgery the best option, or does it vary by patient to patient, or how do you treat this?
So the first thing is you want to look at the causes. So we mentioned water being one incident. So you want to look at someone's diet. You want to look at what supplements they're taking. So a lot of us take vitamin C and vitamin D and calcium. So again, we could be causing our own disease. Medications, Topamax, very common in my line of work, migraines. Topamax causes kidney stones. Diuretics. A lot of our viewers have high blood pressure and take diuretics. If you can't find a cause and you find you have kidney stones that recur, then you get into treatment. Lithotripsy is the most non-invasive. It uses a shock wave to kind of break the stone up. If the stone's too big, then the urologist will actually have to scope this small ureter, go in there, use a laser to break the stone up or break it out. Or worst case scenario, they can actually do a surgery where they cut into the kidney to remove the stone. But as we talk about all the time, it's important to stay, with your doctor, identify these stones early, and do something about it as soon as possible.
You have convinced me to drink more water, or at least non-well water. Dr. Chad Domain from the Avala Network, thanks for your time today.
Absolutely. Drink the water. Stay away from the teas. Absolutely.